Yes.
Does mine work?
I'm gonna double check, but yes, I think so.
Good morning, and thank you for joining us for the first update in October. I hope everyone had a restful and safe weekend. Today, we are happy to have with us Decatur Morgan Hospital President Kelli Powers. Kelli, thank you for joining us today. And then we're thankful to have Alabama Department of Public Health Administrator for the Northern District. Judy, why do I get tickled whenever I start to introduce you? Judy Smith. Judy, it's good to have you back with us.
Thank you, sir. Thank you.
So just an update as it relates to the county. As of today, we have 20,000, right at 200 total cases in Morgan County. That's an increase of 386 cases, or just under 2% this past week. As reported by the Alabama Department of Public Health, the moving 7-day percent of positive rate is about 14%. That's approximately 46,000 individuals who have completed their vaccine series in Morgan County. And for that, we're thankful, but there's still more vaccine available and opportunities to be able to take advantage of that, and we certainly hope that you will. So with that now, Kelli, if you'll give us some update from the hospital.
I will. We currently have 51 inpatients, which is down, and we're thankful for that. 1 presumptive, 16 in ICU, and all 16 are ventilated. The average age of those 16 is 56, and none of them are vaccinated. We have 15 patients we're holding in the emergency room. 4 of those are COVID positive. Several of them are waiting on ICU beds, and so we have no ICU beds, and we've not had any for a while. We do have a good supply of the monoclonal infusions, so if anybody gets sick and needs that, we were out for a while, but thanks to some legislative help, we've gotten it back, so happy for that. We're no longer doing our testing site at Westmead Baptist Church, but there's still the testing site on 31, and a lot of places are testing for it. And then we're still giving vaccines on the Parkway campus, including the Pfizer booster. So Monday through Thursday, 8 to 3, you can call ahead at 973-2888, or you can walk in, and be sure to bring your card if you're getting your booster shot so we can document it. A couple of things I just wanted to mention, still seeing delay in care. So if it's time for, this is Breast Cancer Awareness Month, so if it's time for your mammogram, please come and get that done. But to everybody, please make sure you're getting your routine lab work, you know, anything, any kind of test that you need to have done to make sure you're staying on top of your health. Please do that, because we're continuing to see people finding out and catching things too late. The one thing, I guess, the message today that I'm always asked is, you know, the ICU beds, the lack of ICU beds, and this is what I continue to tell people. We still have people walking in with heart attacks, you know, strokes, other various things that they need to be in ICU, but we don't have any beds for them. And so, you know, that's one of the reasons to get vaccinated and to help this go down, is so that we don't have as many people dying. We've had a lot of death over the last 2 weeks, way too much death for our community, and people that if they had gotten vaccinated, chances are they may still be here with us. So that's my message for today.
That's a tough message, but thank you for sharing. Yeah. All right, Miss Judy.
Well, Mayor, you know, we want to be excited that the numbers are, if you just look at the crude numbers, the numbers are great. For the first time in months, the actual cases across the state are less than 1,000. And at one time, they were up to around 5,000 a day. That being said, and you know, the deaths are also declining, hospitalizations are also declining, but all of that being said, I think all of us have to back up and think about what price did we pay to get to this point. And we paid a pretty stinking high price. As a matter of fact, September was probably the deadliest month that COVID has had in Alabama. We had 2,008 deaths in September. Of those deaths, that represented 28% of all the deaths this year were in that 1 month. And of all the deaths that we have had since the get-go of this, and since we started counting in March was a year ago, it's 14% in that 1 month. So things are better, hospitalizations are better, cases are better, requests for a lot of things are better. But again, what kind of price did we pay to get there? And we can make a decision, we can keep going like we are, we just simply don't want to continue to pay that kind of price. And I don't know, I hope all of you will at some point Google on the white flags that have been placed on the National Mall close to the Washington Monument. There is now almost 700,000, and I know you can't see this, but you can get the picture, but there's almost 700,000 flags that have been placed there as a memorial to the people in this nation who have died from COVID. And of those flags, 14,000 of those flags have been for Alabama people. 346 of those flags have been for people in Morgan County. And one of the things that the people that did this memorial wanted to do is make this memorial, make this situation more than a number. You know, we've had a terrible war for the past year and a half, and that war, in any war, it gets to be a body count war, and I think too often I and many of the others sit here and we talk about the numbers less than we talk about the people. But those 346 flags for Morgan County folks, those 14,000 flags for Alabama folks, each one of those flags represented an individual whose life was lost because of this horrible war, because of a horrible virus. Again, the other tragedy to what I told you about the September numbers is we have a vaccine this year. We have more mechanisms to prevent this disease than we have ever had. We hope it's over. We hope that we're going in the right directions. I will say that we all sat here in May of this past year and we thought, well, we're tired of looking at each other and things are great and things are better. And we went home and went back and did the things that we continued to do. And then we were right back here again because we let our guard down. You know, in any war, in any battle, you know, you don't just sit down and put your armor down and just quit, because the potential for the enemy to come and get you is always there. And so what we will be doing on the healthcare arena, both in Kelli's arena and both in my arena, is we'll continue to play watch. We'll continue to do whatever it is we need to do. So it's not the time to let your guard down. Again, we've paid a terribly high price in deaths to get to where we are. The vaccine's out there, it's readily available, it's clearly very, very safe. When you look at the thousands of doses that we have given, you know, we just urge people to think about it. You know, last year one of the things that we also talked about was the holidays coming up, and we said every holiday has kicked us big time. We've got the holidays coming up again. You know, in September we had things going on, the Trump rally, the Rock the South, a lot of things. We have a lot of things going on right now. Football, people are loving it. What is this ultimately going to do to us? And yes, it's wonderful. Yes, it's great. I love to get out, and I love to go to the arts and crafts shows and to Oktoberfest and to all the great things that are going on. But I think all of us have to decide what price we're willing to pay. Tomorrow, everybody listening to this will be dealing with rain. The rain, we're supposed to have floods and rains and this kind of stuff. You're going to put on your umbrella, you're going to put on your raincoat. And you know what? It's not 100% effective. But what you're doing with that is you're doing the best you can to protect yourself from what's out there. What we urge you to do, all three of us urge you to do, is do the best you can to protect yourself from wherever you are, whoever you're going to be exposed to. Number one would be the vaccine. Now, getting it today is not going to protect you tomorrow, but you know, you go ahead and get it going. And you know, if you're in a situation where whether it's anywhere that there's close contact and you need to feel safe, and you should feel safe, you need to wear that mask. You need to continue to do as much social distancing as you possibly can. I don't want to sit here and look at the mayor again in December and January, because the spike went back up. So please, let's do what we can do to try to keep this where we're going, continue to go in a downward decline. I will tell you that one of the media folks that's here today shared with me on the way in that his niece died this past week, his niece that's not quite 50 years of age. I also lost a niece last week. that was 48 years old. Both of us lost these individuals from COVID. It's still a personal issue that hits home. Those 16 people that are on the vent in Decatur Morgan Hospital, those families are having a tough time. Please do your part. Please, let's just keep these numbers going down. So, thank you, Mayor. Thank you for allowing me to come.
Thank you. Thank you, Judy. So, with us today, we have Dion Hose with Channel 48. Dion, any questions? Okay.
Hi, Nixon with Fox 54. Sorry, guys.
Hey, Nixon. Nixon with
Hello.
Nixon with Fox 54. You're trying to get set up, and we'll certainly give you time to do that.
Yes, I got here a little late. I'm so sorry. I do have a few questions, though. And
Okay.
I'll start with Judy Smith. I've been doing some things. Let me just make sure I got my audio. I have been doing a lot of reports about monoclonal antibodies and about how there's been cutbacks. I had heard that there was 7 states that had used 70% of the monoclonal antibodies, and that Alabama was one of those states. Is that directly, does that relate to the vaccination rates and how they're low here? Is that why more people are getting monoclonals here?
Well, we don't have absolute data on that, but certainly that is an indicator. When you've got a state that has one of the lowest vaccination rates in the nation, then clearly there's likely to be more people that are going to need the monoclonal antibodies. And so, yes, that is why we were using more of it. And I'm glad you brought that up. In fact, I failed to mention that only 40%, yes, we've got a lot of people in Morgan County who have taken the vaccine, but the rate of vaccination is still less than 40% of the eligible population who have had that. So yes, unfortunately, we needed it for all the wrong reasons. Thank goodness we had it. It has been a wonderful, wonderful way, once folks got sick, to keep those folks out of the hospital and hopefully from having severe disease. But we don't need to take it to that point. We need to stop it before we get there. You're talking at most 30-minute visit. You come in, fill out a piece of paper, get a shot, sit for 15 minutes, and you go on your merry way. Versus having to be in touch with your doctor, have to get tested, go to the hospital, have a 2 or 3 hour infusion, have an order. Why in the world would we not want to stay out of trouble over something that's safe? And let me also add to that, both of these are mechanisms to get antibodies. One of them lets your body stimulate it for long-term effect. The other one is actually giving you antibodies. And people will say, well, that vaccine is under emergency use authorization. Let me tell you something, folks. So is that monoclonal antibody. It is also an EUA thing. So either way you go, one of them stays out of the trouble, the other one tries to dig out of it.
And this is my follow-up with that. I know that there's been a federal cutback from the Department of Health and Human Services. Are we really seeing the effects of that, or are we pretty good on our supply here in Alabama?
In North Alabama, to the best of my knowledge, we are doing well. And part of it has to do for the things that we talked about earlier. Hopefully the cases are down some. Hopefully there's not as many folks that need it. But we really, really need to be careful. So to my knowledge, we have not had any reports. There was a little scare on the first week or so about whether we were going to have enough to cover. But right now, it looks like we're doing okay. Kelli, are you guys doing okay?
Yeah, we went with a week or so that we were down and didn't have enough. And we borrowed from other people in the system to meet what we had scheduled. But then now we're back, so we have enough now.
All right, and then Kelli, this is my last question. Sorry, guys.
You're good.
And then Kelli, is testing down at the hospital? I know that we are kind of seeing these trends of downward hospitalizations. Is everything down? Tell me about the trends of everything going down.
Yes, the testing is down. We've seen that, which is really good, and that leads to less hospitalizations. So
But the one thing that's not down are the number of deaths.
right, yeah. A lot of the people, a lot of the reason that we're down from 81 to 51 is we've had a lot of death over the last few weeks.
So before you came in, Nixon, Kelli, you talked about the number of patients that are on ventilators.
16 on ventilators. So we have 16 in the ICU, and all 16 are vented, and none of them have been vaccinated. and the average age is 56.
And this will be my last question, and it's about ventilators. When it comes to, one thing I didn't know before COVID was even really what a ventilator was. And you may not have an exact number, but when you get put on a ventilator, what are the chances of being taken off of one?
Very low. I don't have the exact number, but I would have to say with COVID, we try everything we can to keep you from getting on the ventilator. So once that's our last resort, because the chances of you coming off of it are low.
Thank you, Nixon. We just talked about flu vaccinations last week.
I am so glad you brought that up.
I've already
Well,
had mine.
go ahead.
We have a clinic. The health department has their drive-up clinic, October the 18th and 19th, and I thank you, Mayor, because I had it written down and I just skipped over it. The 18th and 19th, it will be we're gonna treat it very much like we did the early COVID things. Those folks who can come in will come in. We will have 2 running clinics set up, and then anyone who cannot come in, we will give their vaccination at their car. So we will have it all set up, and please consider that also. You sure don't need to have the flu and COVID too.
No.
So last week I had the pleasure of teaching a little Bible study on Thursday. I'm Southern Baptist, but the Bible study I was going to teach was at the local Methodist church. Well, I learned that church was giving, that was on Thursday, the church was giving flu vaccinations on Wednesday night.
Oh.
And so I thought, well, man, if they're giving vaccinations and I'm going to go over there and teach a Bible study, maybe I can slip in and get one. And so I did.
Well, good for you.
Received my flu vaccine.
Good
So
for you.
I never knew that I took it, and never felt anything, but I'm thrilled that I've done that. And I also want to share that I'm a Rotarian. And this month is Rotary Foundation Month. And Rotary's primary mission is the eradication of polio.
Mm-hmm.
And years ago, a lot of folks in this era may not remember, but polio was a lot like what we're seeing with the pandemic right now.
Mm-hmm.
And we didn't worry about the FDA and the EUA and this kind of stuff. We had kids and people being paralyzed, and as parents and as folks, we'd do anything we could not to deal with that. And it also, Mayor, sets another deal. You know, one of the things that we get right now is, you know, y'all don't know what that vaccine is going to do 20 years down the road. We know what it's going to do. We know what COVID's going to do if you get the disease. You're not going to have to worry about 20 years down the road. But look where we went with polio, and you're absolutely right. The Rotarians, there's only 2 countries now that really have major outbreaks that have minor bits of polio because of the efforts of public health and the Rotarians. And it will be, second to smallpox, we hope, the second fully eradicated disease in the world, and that's our prayer.
We're this close.
We're that close. You're absolutely
to being
correct.
able to-
You're absolutely
Wonderful.
correct.
Yeah, being able to eradicate that, or polio. And then before I close, I want to mention one other thing. Sadly, last week, we had 3 police officers in the state of Alabama who were shot within a 24-hour period. One of them right here in North Alabama, Sergeant Reisner, and today Sergeant Reisner will be transported by a procession of first responders from Huntsville Hospital back to the Shoals. That procession will come through Decatur, come across the bridge, and then it will turn to the west on Highway 20. And it's anticipated that will happen about 1 o'clock. And if residents can safely line the road there to pay their respects, I think that would be a wonderful thing for him and his family. So with that, I want to say that the holiday season is getting closer, and we urge you to consider getting both your COVID vaccine and your seasonal flu vaccine if you haven't gotten them already. And then for COVID vaccines, if you can still visit the health department, the Decatur Morgan Vaccine Clinic, please do so, or go to vaccinefinder.org to locate an additional vaccine provider. And now, This is, don't take what I'm fixing to share with you right now to be that we're becoming complacent. We're not. We need to keep our foot on the gas. But this is going to be our last update for a little while. And nothing would thrill us more that we don't have to come back in here and do this. It's not, we'll take the time that we need to take to update our communities. But if we can get folks vaccinated, we won't need to do this, and that's the case, and that's where we would like to go. So we're going to suspend these for now, and then if we decide that we need to start them up, then we'll let you know through some type of press release. So that said, until next time, be safe and be kind.